Okay, welcome everybody. Good afternoon to you. I'm Fields Mosley, the Communications Director here in Maricopa County, also the lead PIO for our unified command that includes public health and emergency management here in Maricopa County. Welcome. Thanks for being here with us today. We're going to be talking about data today. We receive a lot of different types of data. Public health helps us surveil COVID-19 in our community. You guys have all asked a lot of questions about this over the last 2 months. So we're going to address some more specifics today and really how this varies from state to state a little bit too, and some of the differences there. Public Health Medical Director Dr. Rebecca Sonnenschein will be our primary presenter and spokesperson today on this. She'll have an explanation of the Epi Curve and how this data informs our strategies as we push forward and deal with the disease within our community. Emergency Management Director Robert Rowley, also Public Health Director Marcy Flanagan. They are in the room with us as well, as if one of your questions is better addressed by them. So let's go over some of the rules of the road, if you will. We will take questions from members that are joining us via the webinar, and we thank you for those questions. You will be called upon by our moderator, just like we did on Monday, and that moderator will then unmute your mic. So if you raise your hand within the virtual room, please have your mic unmuted, whether you're on your phone, your laptop, wherever you might be. And then we will call upon you and unmute your mic so you can ask your question. I ask that you ask only one question. As you saw on Monday, we were able to return and get second and third questions from reporters. We'll try to do that again today. So that's all the logistics I had for you today. I'm going to ask Dr. Sonnenschein to come up and talk a little bit about the data we're seeing, and then we'll take some questions from members of the media who are on the webinar today. Dr. Sonnenschein?
Good afternoon. This week is National Public Health Week, where typically we talk about what public health does to support the health of people in our community. With the ongoing COVID-19 pandemic response, there's a lot more awareness of public health and what we do on a day-to-day basis. One tool that we use all the time that has been in the news a lot lately is the Epi Curve. Epi is short for epidemiology, which is the study of the control of disease and populations. What does an Epi Curve tell me? What the Epi Curve tells us is how many new cases are diagnosed every day, whether we're seeing an increasing number of cases or a decreasing number. So are things getting worse or are they getting better? The slope of the line tells us how quickly things are getting worse or how quickly they're getting better. And the overall shape tells me, is there a single source of this outbreak or are there many different potential sources? So what does the Epi Curve not tell me? For one thing, it doesn't tell me how many people have the disease but either aren't going to their healthcare provider to get tested or just can't get tested. It also doesn't tell me how many people have the disease but don't have any symptoms at all. And it definitely doesn't tell me what is going to happen next or how long the outbreak will last. So what we're going to look at today is a hospitalization Epi Curve. And this is one way that we can follow trends when there isn't enough testing available to accurately reflect all the disease in the community. It allows us to follow trends of more severe disease requiring hospitalization. Since hospitalized people with COVID-19 have been prioritized for testing from the beginning, the availability of testing doesn't change the Epi Curve on a day-to-day basis. So when I follow the number of people who are hospitalized, it's a truer estimate, not of how many people are sick, but of the trend over time and whether it's increasing or decreasing. And that's one way that we can see the shape of the curve to know where we are in the outbreak. So it turns out we don't have complete data for most diseases, including influenza. So we have lots of practice not having enough testing available. And one of the ways that we know what's happening with flu every year is that we follow both hospital and emergency room visits for influenza-like illness. So what we've done is we've taken the symptoms of COVID-19 and we're also following emergency room data and hospitalization data for COVID-19-like illness, and that's another way that we track how much disease is out there. In fact, we're using all of the same epidemiology principles and tools that we use for every outbreak for the COVID-19 outbreak. We follow the trends and we implement strategies to prevent disease spread based on what we're seeing in our epi curve. So, this epi curve, which is those who have been hospitalized on a day-to-day basis, shows a blue line that has a slightly steeper slope in the middle to the end of March. And then when you get to early April, you can see that the slope of that line declines just a little bit. So there's always that decline in the slope of the line tells us that we are effectively starting to flatten the curve, which is what we're hoping to do. This shaded region in the end of the epi curve is because there's always a delay of when we detect hospitalizations and when we can finalize the data. So the shaded bars, we know that there will be at least that many hospitalizations, but the data aren't complete yet. So now that we know that we've begun to flatten the slope of that curve, the question is, how long do we need to maintain this level of social distancing so we make sure that we don't overwhelm our healthcare system and that we allow people to have the benefit of going to work and to maintain their social connections? So the goal of flattening the curve is to delay the peak of cases so we don't overwhelm the healthcare system, to make sure that those who do need healthcare get the best care possible that we can provide in the United States. So once we're over the peak of that slope of the flattened curve and on the downward side of the slope, we can start to think about relaxing these measures gradually so we continue to move in the right direction and get back to normal. And I'll take questions.
So we're going to follow a similar procedure, Dr. Sonnenschein, if you want to stay right there, from what we did on Monday. And so if reporters have questions, please raise your hand virtually in the webinar right now. And we will, I'll repeat your name if I can hear your name, and then also we will, I'll repeat your question or summarize your question so we make sure everybody hears it on the webinar and on Facebook and YouTube right now. Do we have any questions for Dr. Sonnenschein?
We have some hands raised now. We have a question from Claudia. Claudia, your microphone is open.
Claudia, go ahead with your question.
Oh, thank you. Dr. Sonnenschein, you mentioned the big question is how long do we have to maintain this level of social distancing? Of course, if you want to go back to work, that's the number one question, and make sure we all stay healthy. So looking at the curve, and I can see it very well from the webinar, when do you predict, or do you have predictions for the time frame for going back to what is normal?
Okay, the question is, when might we get back to normal? So I'll let Dr. Sonnenschein address that.
Yes, I think that's the question that we're all asking each other. And all I can say by looking at our data is that what we're doing with social distancing seems to be working because we're already starting to see that slope flatten out. But if you look at that curve, what we're doing is we're still on the increasing part of the slope. So we need to get up and over the peak and back down well below that line where we're declining and we're below what our healthcare system can manage. And at that point, once the curve dips below that line, we can start to pull back on those social distancing measures, and more than likely, we'll have to do it gradually because the evidence shows that if you pull back all at once, you might see another peak. So all I can tell you is what things will look like when we can start to make those recommendations, but I don't think anyone can predict exactly when that will happen.
All right, thank you for that question. Do we have another question, Chad?
Yes, we have a question from Rocio Hernandez.
Go ahead with your question.
Hi,
Are you still there, Rocio?
hello.
Yes. Go ahead.
Yes, can you hear me?
Yes.
Okay. I wanted to ask if patients are still finding access to coronavirus tests at this time, or are they pretty limited?
So the question is about testing availability, and I believe we know about that. So Dr. Sunshine?
So what I can say about testing availability is with the ability to have commercial testing come on board, we're seeing a lot more commercial testing available to people. What's limiting the testing is not the availability of that commercial testing. It's still the supply chain that limits our ability to get the supplies that you need to collect the specimens for testing, and also the personal protective equipment that healthcare providers need in order to safely collect those specimens from patients. So we know that there's plenty of testing out there and available, but those supplies are still harder to come by. But we are seeing more availability of drive-through testing in the community and different types of testing that may not need all of those different supplies. So we do believe that testing is becoming more available than it was before.
All right, good question on testing availability. Do we have another question?
We have a question from Stephen from New Times. Stephen, your microphone is on.
Go ahead, Stephen.
Hi, this is a question for Dr. Sunshine. Last month, you stated that it was too early to close down schools and restaurants when they did so. Do you stand by that statement now, given what you're saying about social distancing working?
So the question is about some comments made, I believe, at a Phoenix City Council. I don't recall if it was a meeting or a work session, but it was, and that Dr. Sunshine was asked directly about predicting the future, and we know how difficult that can be. So, Dr. Sunshine, how would you respond?
Yeah, so I want to be clear about what I did say during the Phoenix City Council meeting. I was asked about the appropriate timing of closing schools and businesses. And I want to make sure folks know that there's not a lot of data about COVID-19 in particular. But the bottom line is I fully support social distancing, and it's really difficult to know what the right timing of those measures are. We also know that once you pull the trigger and you close businesses and you close schools, you have to stay the course and you have to maintain those practices as long as you need to get over that hump of the curve and back down on the other side. So when I was asked what I would have done, I simply stated that from a purely public health standpoint, I had one perspective, but I definitely respect that the governor has to take in a lot of other considerations, and I fully support the decisions that he made and the timing of those decisions because he had to take a lot of things into account when he was making them.
Okay, thanks, Stephen, for that question. Do we have another question?
We have a question from Peter Samori. Peter, your microphone is live.
Hello, good afternoon. Do you think the case rates, I know you didn't want to project or predict anything, but do you think case rates will flatten over the extreme summer heat? Will this summer heat have anything to do with reducing COVID-19 transmission and so forth like it would the ordinary flu? And if so, why or why not?
Okay, the question is about, for those if you couldn't hear it, it's about whether or not the cases might go down simply because of summer heat and how that might affect this virus. Dr. Sunshine?
So you're asking the question that all of the experts are asking too. In fact, there's two types of models that are out there, and every model's a little bit different. We've talked before about how they all have assumptions or best guesses at what's happening with the disease. But if you change whether there is seasonality to COVID-19, like there is seasonality to flu or even other coronaviruses that cause colds, we know there's more colds in the winter than there is in summer. If that seasonality does exist, then it completely will change the shape of this curve, and it will also likely change our strategies. We just don't know whether there will be seasonality, and we also know that Arizona is so hot and particularly dry that it may affect how things are in Arizona relative to how they are in the rest of the United States. So we are all sort of hanging on the edge of our seat, waiting to see, just like you are, knowing that if it does look like there's a seasonal pattern to this disease, then our models are going to change, and so will our predictions for how this will go.
So good question. All right, do we have another question, Chad?
Claudia from ABC 15 has a question. Claudia, your microphone is on.
Hello again. I know you don't do projections, you said we're on the right path, but do you, the model that you're using, do you have projections for deaths, like first and best case?
So Claudia, correct me if I'm wrong, but you're breaking up a little bit, but I believe you asked if we're projecting worst or best case scenarios. Is that correct?
For deaths, yeah, and
For deaths in particular. So worst and best case scenario for deaths within our community.
So the state is working with academic partners to do modeling. And as you know, there's a lot of other models that are out there with varying assumptions. What we're doing here locally is we're focusing on the data that we actually have reported to us, with a pretty intense focus on our death surveillance. So we're not just tracking how many cases are identified in our death certificate data, we're actually reaching out and doing a special active surveillance and screening process for anyone who dies at home to see if they had symptoms consistent with COVID-19 before they passed, or if there was respiratory disease circulating in the household. And that allows us to give our best estimate of how many people truly are dying from COVID-19. We may have to estimate some proportion, but between the death certificate data and what we can estimate from our active surveillance, we will have a best guess. We are not using models locally to try and predict the deaths that we're going to see, because we really need to focus on the data that we have here, and we're relying on the state to do that for us, and we're following their lead.
Okay, good question. Another question, Chad?
Rob Britt has a question. Rob, your microphone is live.
Yes, hi, Rob Britt from Anthem News. There's solid evidence from past viral epidemics, including the 1918 flu pandemic and SARS in 2003, that relaxing social distancing and other preventive measures too soon can lead to a second wave of outbreaks. Are you modeling that, thinking about that, worrying about that?
Yeah, so we're talking, so Rob is asking about whether or not we're modeling or looking at relaxing those social distancing or any of these other restrictions that have been put in place statewide, and whether if those are relaxed too soon, we might have a second wave. I believe Dr. Sonnenschein already talked about that quite a bit, but can you answer the question directly?
Sure. First, I want to address the comparison with the 1918 pandemic influenza as well as SARS. Those diseases are quite a bit different from this one. The 1918 pandemic had a mortality rate of 2.5%, which is a lot higher than what we're estimating the mortality rate of COVID-19 to be. We think the highest that it's going to be is 1%, and it could even be lower, particularly in the United States. Additionally, SARS in the previous outbreak also had quite a bit higher mortality rate. So know that when we use data and evidence based on those particular disease outbreaks, we have to take things with a grain of salt. And then the second part of this is all of the experts believe that if you pull back on social distancing either too soon or too abruptly, so all at once, that you could see a second peak. So we are absolutely taking that into account, and that's why we're not just waiting until we're over the peak, but we're looking at waiting until we're over the peak and below that line on the other side before we really start to consider pulling back. And again, there's lots of modeling out there. No one can predict the future, but we are following the state's lead on when to implement that pulling back of social distancing.
Okay. Chad, do we have another question?
Yeah, Stephen has a follow-up question. Stephen, your microphone's live.
Hi, I was wondering, what is the current policy in Maricopa County for contact tracing?
So the question is about contact tracing, and I assume, Stephen, you're asking whether or not we're doing it at this time as our number of cases have increased. Is that correct?
Yeah, whether you're still doing it, and who qualifies for contact tracing situations, I guess. Yeah.
I will let Dr. Sunshine answer that.
So it's a good question, and obviously this is a very large outbreak, and we're seeing sometimes hundreds of cases a day. And we have our epidemiology team, we have probably tripled or quadrupled the number of people that normally do investigations for this response. And even with that massive amount of increase in our staff, we are still having to maximize what we spend time on. So we are still in a position where we're contacting every single case, finding out who their contacts are and what their and letting them know what they need to do to control the spread of disease. But we're activating something called case-mediated contact tracing. So we talk with them about who all of their contacts are and what that means, and then we provide them with information from public health to provide to their contacts, so their contacts are aware of the exposure, know exactly what to do to keep themselves from spreading the disease, and who to call if they do develop symptoms.
All right. Do we have another question?
Yes, Leon Gonzalez has a question. Leon, your microphone is on.
Thank you for the time. And my question is about undocumented people. If you have numbers, if you have a register of the number of people that is looking for treatment, and at the same time, if you have resources for them, because as you know, the most of them, they have fear to be reported with authorities, or with this new rule from the federal government, if they ask for help or economy or money or from the hospitals, they would be in a difficult situation if eventually they can adjust their status.
So the question is, for everybody on Facebook and the webinar, it's if you didn't hear that, the question is, do we have resources or outreach to undocumented individuals who might be living in our community? I'm not sure if Dr. Sunshine is the correct person for this question. I will say I do know we have outreach to hard-to-reach populations. Public Health has a liaison that is constantly reaching out to organizations who are in touch that may be folks that who are undocumented or not, but they're considered populations that are underserved traditionally in our community. So I know we have a liaison that's on a phone call every single week about that. Marcy Flanagan, our Public Health Director, can fill in the gaps a little bit more in my knowledge. Thank you, Marcy.
Good afternoon, I'm Marcy Flanagan, Maricopa County Department of Public Health Executive Director. So if there are individuals who are looking for testing or care and they don't have the resources or they're looking for resources, they can go to arizonatogether.org, and that's going to have a list of health centers, community health centers that are doing testing and will work with individuals on payments and insurance and are not going to ask their status of their citizenship. So those are some great resources if they go to that website, and there should be contact information and phone numbers for them to follow up with.
All right, great answer. Thank you very much, Marcy. Any other questions?
Claudia has a follow-up question. Claudia, your microphone is live.
Go ahead.
Thank you again. Dr. Sunshine, for people who are at home, who've been trying to follow rules, also out of work or frustrated to care their kids, trying to teach them their lessons, what is the takeaway that you want them to know from what you're seeing?
So the question is, what would Dr. Sonnenshine's advice be, or what would she like people to know? This is kind of an opinion question as opposed to a fact question, but I think as a medical doctor you could probably opine on that a little bit.
I think the takeaway point is that social distancing or physical distancing is hard on everyone, that we know it's difficult, And we know that everyone is making a sacrifice by staying home, and particularly people who aren't able to go to work and to make money. And that does have public health consequences too. So we're aware of that, and I think that's why we're all working together to make sure that we implement these social distancing measures for as short of time as is possible in order to control the spread of disease, make sure it doesn't exceed the ability of our healthcare system to manage it, but to pull back as soon as we possibly can so that people can go back to work, make a living, maintain those important social connections that we need to stay healthy physically and emotionally. So my message is, it's working, keep doing it, and we're doing everything we can to see when we can pull back.
Do we have another question?
Yes, Allison Steinbach has a question. Allison, your microphone is on.
Go ahead, Allison.
Hi, thanks so much. Does the county plan to release data on cases and deaths by race and ethnicity and/or cases and deaths by zip code?
So the question is, are we as a county planning on releasing data by zip code or data by race and ethnicity? Dr. Sunshine?
Okay, first I'm going to start with zip code. We are in the process of putting together our data by primary care area. And what that is a geographic area in which most of the residents in that area seek healthcare services from the same place. And it's often how we break down diseases by geographic location in the county. So we're hoping to have that up by early next week, so that people can kind of see a geographic representation of where cases are. And the reason why we're able to do that now, and we weren't able to do that before, is because we have enough cases in each of these areas that you can't use that information to identify where a particular person lives or works. The second question is collecting data by race and ethnicity. And I know that we're hearing a lot of information nationally about the increased rates of death and severe disease among African Americans. And I want to talk about why we think that might be. One of the things we know about African Americans is that they tend to have higher rates of high blood pressure, cardiovascular disease, and diabetes. All of these things that put you at higher risk for severe disease from COVID-19. So unfortunately, when you have a higher rate of these underlying conditions in a population, you're going to see a higher rate of hospitalization and severe outcomes in these individuals. And that's why it's really important for people who have underlying health conditions or are 65 or older to take extra precautions to stay 6 feet away from others and to make sure that, that if anyone is sick around them, that they don't get exposed. Lastly, I want to say our ability to collect race and ethnicity data is limited in cases. The way we collect our data here is that we get a certain amount of information that's automated through an electronic laboratory system, and unfortunately, that rarely includes race and ethnicity. The one place that we can reliably get race and ethnicity data is from death certificates, and so we are looking closely at the race ethnicity breakdown among deaths, and we should be able to have that available shortly.
All right, another question?
There are no pending questions, Phil.
Okay. Well, with that, we will wrap up this Wednesday's press conference. Thank you so much for being here today. We will send out an advisory of our next press availability that might include Dr. Sonnenschein, very likely, or Marcy Flanagan, or some of our other subject matter experts from around the county. Of course, I've said this to many of you before, we're working in a bunch of different areas whenever it comes to trying to find relief for our community whenever it comes to the COVID-19 pandemic. So if you'll indulge me for a second, one thing I did want to mention really quickly, if people are home, if you're watching this right now, please fill out your census. That is a message that's kind of gotten lost. If you've seen any of the latest stories about this, you as friends in the media, you can certainly continue to push that message as we continue to do on our social media platforms and whatnot, but fill out your census, you got the time, and you can do it electronically this time around. So very important to bring more resources into our community as we head into the summer months. So thank you all for being here today. Again, if you have questions, the Joint Information Center's email address, caomedia@maricopa.gov. Thank you all so much for being with us today, and we'll be in touch soon about our next availability.